Dr. Unwin, let's talk about medications. I mean, especially for people who are on a number of drugs for so-called chronic conditions, which we now know are reversible through lifestyle changes or dietary changes. And yet these people are given medications lifelong without understanding the side effects of some of those medications. I mean, let's start with the most, or what people think is harmless. They take it almost like candy, as the Americans would say. So acid reflux medication. I was given them. Yeah. I was given them 20 years ago when I was in my early 20s. And of course, the reason I had acid reflux, which I haven't had since I adopted low carbohydrate diet, was because my glycemia was high blood sugars. So.
Yeah, I mean, there's quite a bit to be said about medication. The first thing is there are no effective medications that don't have both pros and cons. And the decision-making process is to weigh up for the person in front of you the pros and the cons. And if you don't know, if you never discuss side effects, then how is the patient to know whether this is a good idea or a bad idea? And so it's always worth asking doctors or prescribers, what are the common side effects of this, so that you know, and are there alternatives? Do I have to take the medication, or could I make a change to my lifestyle? Another thing we must cover is people who are already on medication, because you've got to be careful if, for instance, as you know, you couldn't possibly stop your insulin because you need insulin to live. But there are other medications which you couldn't just go low carb and stop your medication. And so I would say for people on medication for the diabetes, prescribed medication, they would be well advised to discuss going low carb with the prescriber. And actually there is a paper, another paper, which you can print out and take with you to the consultation. So if you Google, it's published in the British Journal of General Practice. And so I'm one of the, so it's Google BJGP, Unwin and Murdoch. And you'll find that there is a paper on that with which medications are safe with low carb, which need care. And you could always then discuss that with the prescriber if you are hoping to cut back on medication, and that would guide the process and indicate to your doctor that there are other doctors who are doing this, and keep it safe. But yes, certainly in my own practice, what I find is that most people would rather avoid lifelong medications if you give them the chance. And I call that my golden opportunity, which is, would you like to start metformin for your diabetes today, or are you interested in an alternative? And many people are very interested to avoid medication. And I wish I'd done more of that as a younger doctor and not prescribed as many medications as I did. I think you need to look at the pros and the cons.
I will put all those links below in the description below the video. However, for my audience, I have interviewed Dr. Murdoch, Campbell Murdoch.
Oh, yes, he's lovely, isn't he? Yes, so full of enthusiasm.
Is he the one that wrote the paper with you?
Yeah. Yes, he and I wrote that. Campbell and I are friends, and he's full of a young guy, full of enthusiasm. There were other people who wrote the paper as well, but yes, Campbell Murdoch, you're right, that's the one.
I've interviewed him, and he mentioned in the interview this paper, specific paper that is targeted to physicians, advising them on how to de-prescribe.
Yes, that's right. But all of the papers, what we've done is our charity, the Public Health Collaboration, of which Campbell is also a member, funds the open access of these papers so that the general public can also download and read the papers or print them off and take them to their physician.